So at the moment, as you know, I'm in a situation that's pretty similar to yours, although it didn't destroy my political career. It certainly did in my clinical career, that's for sure. Much to the chagrin and damage of my clients, by the way, some of whom I had a relationship with that spanned years and sometimes decades, which all burned up in an instant. And they're hauling me in front of they've threatened to haul me in front of an interview because I told them to go to hell with their insistence that I be re-educated interminably by their experts according to their standards for a duration they choose. And so now I'm supposed to face the same sort of in-person examining board that just grilled you over the coals. But they're delaying and delaying and delaying because, well, why not, I suppose? I think they're suffering from the extreme delusion that if they leave this hornet's nest alone, the hornets will leave, but that's definitely not going to happen. So I've been calling on them publicly in Canada rather repeatedly to get on with the Inquisition, but at the moment they're hiding behind a variety of bureaucratic idiocies to make the case that they have the right to delay the investigation beyond the statutory limitations for it that they've even imposed upon themselves, right? Because there's a 150-day period within which, if I understand correctly, within which these are supposed to be, brought to something approximating a conclusion once they've been initiated, so that you're not hung out to dry forever. But, there's always a reason for bureaucrats to get around their own bureaucratic limitations, and that's certainly happening in the Canadian situation. But did they give you the sense that you better continue to step lightly, Dr. Jenson, because with your reprehensible history of 6 investigations, it's only a matter of time until you say something else cataclysmically inappropriate and we haul you in front of ourselves again? Or do you think maybe they've gone back into their lair to find someone else to torment?
I think there was a clear understanding that there were a couple things that were really problematic for them, and that if I would once again engage in that kind of activity, I would very likely appear before them again. I think specifically...
So what would those be? Yeah.
I think specifically utilizing off-label medications for the treatment of COVID-19.
Physicians do that all the time.
I pointed that out to them. I pointed that out that many pediatricians would have more than 50% of their prescriptions would be off-label. But specifically, the off-label use of ivermectin was very problematic for them. And
how dangerous is ivermectin if you look at the VAERS reports?
If you look at the history of the medication, the FDA data, and the VAERS data, I think ivermectin for a 5-day course is extremely safe. Now, whether or not
looks like it's about as safe as water, right? I think you'd have to scour the medical literature long and hard before you found a drug with as low a proportion of side effects to benefit as ivermectin. There's been millions of doses given, and the side effect reporting is so remarkably low that it's a kind of miracle. So if you're going to administer agent off-label, it's hard for me to see how you could do something that would bring about less likely harm than ivermectin. Do you think that's a reasonable position?
I think ivermectin is very safe. I think a lot of people don't realize that it's available over the counter in topical forms. I think there's a medicine called Sklice that people can purchase on their own. But I think that the Board of Medical Practice made it clear that this was a big deal. I think they also made it very clear that what they perceive the standard of care to be, they often talked about the minimum standard of care. They asked me, what do you think the minimum standard of care is? And I said, I've never really thought about the minimum standard of care because that's never what I've aspired to